So the short breaks duty was created in 2008 as an amendment to the Children Act 1989, which is where most of the key law on social care services for disabled children sits. And the duty requires local authorities, when they're providing services to children in need, to in particular provide short breaks to parent carers of disabled children. And very importantly, the wording of the duty talks about helping parents who are at crisis point, but also helping parents to care more effectively for their children. So it's very clear that the duty isn't just about a crisis response, but that there should be a planned series of short breaks available to build resilience in families, to help children and families lead ordinary lives. And that was at the centre of the new duty and in the regulations and the guidance that sits under the legal duty. One of the key elements of the duty is a requirement which is in the regulations that the local authority has to publish a short break services statement, and that came into force in 2011. And the short break services statement has to set out what breaks should be available in the area, and importantly it should also set out what if any, eligibility criteria the local authority are using to decide who gets a break and what level of break they might receive. And that has to be published. It's a specific requirement in the regulations, but the statement has to be published. So every parent forum should be able to access the short break services statement for its own local area. Perhaps even more importantly, there's a requirement to keep the statement under review, and there's also a requirement to consult, both when it's produced and when it's reviewed. So in this area, we actually have a specific statutory duty imposed by the regulations, which says that local authorities have to consult with parent forums and other parent carers of disabled children, both when they're drawing up their statement, which they should all have done now, but also when they're reviewing it. So there's an ongoing opportunity, or there should be at least, for parent carers and parent forums to be involved in making sure that the short break services statement is accurate, but also that it's ambitious, that it properly reflects the spirit of the duty, which is that there should be a wide range of breaks available to meet a wide range of needs that disabled children and their families have. It's very clear that short breaks, having expanded hugely under the Aiming High for Disabled Children programme, that funding for short breaks is being looked at by many local authorities, and some are choosing to cut funding in that area. And I think that's a key issue for parent forums to be campaigning on at the moment, and to be working with local authorities to explain how short-sighted it will be to remove funding from short breaks, because it is the key service that families have constantly said is needed to prevent family breakdown and to prevent families going into crisis. And so the cost of withdrawing short breaks is often very much more than the savings that can be made. That's all political, small p political messages that can be put across. In terms of legal messages that parent forums can use, again, one of the big areas is the public sector equality duty under section 149 of the Equality Act 2010, because that duty requires public bodies to have due regard to a number of specified needs, and one of the key needs is the need to advance equality of opportunity for disabled children. And so that means they've got to look to make things better for disabled children and families, not worse. And it's very hard to see how a decision to significantly reduce the level of short break care that's available is consistent with that need, which they have to have due regard to. And that's a pretty strict legal duty that Parliament has imposed. So it is possible for local authorities to lawfully reduce the level of support that's being invested in short breaks, but only if they go through the right process, and that includes paying due regard to the public sector equality duty. So a very good question that parent forums can ask is, where is evidence of that due regard? Has there been an equality impact assessment? What does the local authority say? What does the lead member for children's services say about the requirement to have due regard to the need to advance equality of opportunity for disabled children? And how is this decision to cut or close or reduce the service consistent with that? So that's one very important area. The other is that it may well be that for individual children there is a right to a short break if the local authority's assessment of that child shows that it's necessary. Because if a service is necessary, then there's a duty to provide it under Section 2 of the Chronically Sick and Disabled Persons Act 1970. And so the local authority has to be very careful, because if it takes funding away from short break services, it may then end up breaching its legal duties to individual disabled children, where there's an assessment which shows that the service is needed. And that's another important argument I think Parent Forum should be putting forward, to explain to local authorities that a decision, a high-level decision to take funding away, may result very shortly in legal breaches for individual children and families, all of which could be remedied through judicial review, which is of course a very expensive process for the local authority to be engaged in. Where disabled children have health needs, it's very interesting to see how the new NHS that arises from the 1st of April, with very different structures and legal duties, is going to impact on that. One of the key duties now is Section 3 of the NHS Act 2006, and that now creates a specific duty on clinical commissioning groups, which have just replaced primary care trusts and are the equivalent of the local authority for health. There's a specific duty now on clinical commissioning groups to provide health services that are reasonably required by, for example, disabled children. So if there's a situation where the child has a health need which has to be met during the short break, then health through the CCG has to cooperate with the local authority to make sure the service is provided effectively and safely and in a positive way for that child. And we already have a very strong legal duty to cooperate in Section 10 of the Children Act 2004 that requires the local authority and health to work together to safeguard and promote children's welfare. So that should be happening as a matter of course already, notwithstanding the new duty to cooperate that may come in the Children and Families Bill. If the child has very complex health needs, then it may be that the clinical commissioning group has to take the lead and has to actually provide the break, and there has to be, for example, a high level of nursing care provided. And there you need to look at the National Framework for Children's Continuing Health Care, which has a decision support tool and a process that needs to be applied in every case to decide whether the child is eligible for continuing health care, and then a decision-making process about what nature and level of service they're going to receive if they are. But one thing the courts are extremely disappointed to see and will act very strongly against is cases where children are allowed to fall between the gaps, and where, for example, a local authority and a health body are arguing amongst themselves as to who's going to provide the service. One of those bodies should take the initiative and provide the service, and then the argument about who pays can be had after the event, if necessary, by reference to the Secretary of State. And where children with complex needs are missing out, that's exactly the kind of case that the High Court will be willing to hear on an application for judicial review. It's really important to remember that there are duties to assess on health as well as the local authority. So the local authority has a clear duty to assess under Section 17 of the Children Act, and the guidance that has now changed from the 15th of April. We have new guidance on Children Act assessments called Working Together to Safeguard Children. But there's still basic principles of the old framework for the assessment of children in need still apply, and there's a maximum time limit now of 45 working days for an assessment to be completed. Health, however, will have to do an assessment if there's a question about health input into the package of care. Now, a core assessment, which was the old style name for the assessment under the Children Act, was supposed to be multidisciplinary and still should be under the new Working Together guidance as well. So health should have been part of a core assessment type process. But if there's a need for a standalone health assessment for a particular health need, say, then that should be done. And also, if the child has complex health needs, then health have to lead on the National Framework for Children's Continuing Healthcare process. So the decision support tool is again multidisciplinary, but it should be led by the clinical commissioning group. So it's important to bear in mind that families get very frustrated by being required to have multiple assessments, but from a legal perspective, the assessment is always at the heart of any legal duty to provide. And so it may actually be necessary for there to be a health assessment as well as a local authority assessment in order to establish that there are needs that then have to be met. The intention of the Education, Health and Care Plan and the assessment that then leads to it is, as I understand it, to try and create a more joined up approach. We don't actually need that legal reform to make that happen. There's already a power under the Children Act to do education and health and social care assessments at the same time. But if we have a new structure that promotes that, that would seem to be a good thing. However, the problem at the moment is that there's not going to be a duty to provide the social care aspect of the provision that's set out in the Education, Health and Care Plan. There was always going to be a duty to provide the education provision, We're now told there'll be a duty to provide the health provision, but currently there's nothing that says that the social care provision needs to be provided. So we don't yet have a properly joined up approach, in my view, to the education, health and care plan. It may be, I hope it will be, that the passage of the bill through Parliament sees that problem go away. But there will always be separate duties on education, health and care to provide certain services at certain times. And it may therefore be that separate assessments are a necessary evil to some respect in order to make sure that those duties are being complied with. So in terms of the duty to provide short breaks to an individual child, the first starting point is always the assessment. And the duty to assess comes from Section 17 of the Children Act 1989 and the guidance which is now working together to safeguard children. Section 17, though, of the Children Act doesn't impose a duty to provide services to an individual child. It's what's called a general duty that's owed to all children in need. So there has to be services available for children in need, but no individual child in need has a right to a service under Section 17 of the Children Act, which is why it's so important for disabled children that Section 2 of the Chronically Sick and Disabled Persons Act 1970 exists, because that does create a specific right to a service. And the right comes into force where the local authority has assessed that it's necessary to meet the child's needs by providing, for example, a short break in the community or care at home. And that's a really important legal provision that isn't well understood, unfortunately, and actually is at the heart of most of the legal challenges in this area, because the duty that's being breached if no services are provided is usually Section 2 of the Chronically Sick and Disabled Persons Act 1970. Parent forums need to be relying on that duty, because forums will often be told, well, children's services are discretionary, we don't have a duty to provide. And that may be true under the Children Act, but it's not true under the 1970 Act, and that's why things are different for disabled children than they are for other children in need. Another big issue that often comes up in short break cases is whose needs are being met. And the right answer has to be everyone's, because children live in families and children's needs can't be separated from their parents' needs or their siblings' needs. So a proper assessment under the Children Act should be holistic. It should look at the child in the family circumstances and looking at all the family and environmental factors that come into play. And a decision should be made about what provision is going to be made for that child, looking in the round at the family. As well as the Children Act assessment duty, there's another important duty under the Carers Acts, and parent carers of disabled children are carers for the purposes of that legislation, and they are entitled to carers assessments. And it may be in some cases that there does need to be a separate carers assessment done to look at things specifically from the parent's perspective. But my view is that in most cases, a proper, decent, lawful Children Act assessment should pick up the issues that affect the parents as well. For example, needs to work, needs to study. Those are all factors that should be taken into account through the Children Act assessment route too. So parents have an absolute right to a carer's assessment if they want one, if they need one. But my view is that they shouldn't have to necessarily go through that additional assessment as well in order to get a sufficient level of service, because it should come through the Children Act assessment route. Parent carers shouldn't be told by a local authority that they're not entitled to a carer's assessment because a Children Act assessment has been done. If parents want a separate carer's assessment, they have a right to it. And there may be some issues, for example, that the parents don't want to bring up within the child's own assessment. There may be some separate issues that they want to raise about their caring role and responsibilities. So there could be a very good reason why a separate assessment is needed, and in any event, parent carers don't have to have a reason. They have a right to a separate carer's assessment if they want one. So it should only be in cases where parents don't feel that a separate assessment is necessary that one isn't carried out. I'd hope that would be the majority of cases. But if the local authority isn't doing its Children Act assessments well and isn't properly bringing in parent carers' views, then they'll have to do more separate carers' assessments as a result. So it will all depend on the quality of the work that's being done in relation to Children Act assessments, in my view.